Good evening, participants. Thank you for joining Shield Connect. And today we are back with our famous program, Icons in Conversation with Dr. Ritu on Shield Connect. So before I start with the session, let me give a brief introduction of our speaker and Dr. Ritu. So let me share my screen. So today the topic is elective oocyte cryopreservation for age-related fertility decline and facilitating informed decision. And icon for the today's speech is Dr. Mustafa Zakaria, and this program is sponsored by Dr. Ritu Santwani. So before we start session, let me give a little introduction of our Madam Dr. Ritu Santwani. Ma'am has done MBBS, MD, and MRC, member of MRCOG. Ma'am is working as a consultant in Shambhal Women Clinic in Koregaon Park, and also ma'am has recently have a new fitness new studio in Koregaon. So, ma'am, congratulations for your new.
Thank you. That is 360-degree healthcare studio.
Yes, ma'am.
Yeah.
So, let me also give a brief introduction of our icon for the day, Dr. Mustafa Zakaria. Sir is MD from Morocco, and sir is the chairman of Executive Committee of Moroccan Society for Endometriosis and Reproductive Medicine. And sir is senior clinical embryologist and assisted in assisted reproduction. Sir has extensive experience and covers all aspects of clinical embryology and endology. Dr. Zakaria obtained his master degree in clinical embryology and assisted conception from Northwestern University, USA. ART as a consultant reproductive biologist in IVF laboratory, fertility center, IRIF-IV from Casablanca, Morocco, and Group Vice President of Scientific Research in 2018. And sir has obtained a research fellowship certificate from IRIF-IV-AI-SRG 2020. Sir is sir also got his certificate in clinical reproductive science in November 2019. And sir has acquired a distinct interest for oocyte and somatic cell communication, embryo morphology, and optimizing quality in the clinical IVF lab. And sir is member of vast societies like ASHRAE, AC, SRB, ARCS, then Moroccan Society of Reproductive Medicine since 2018, and of Royal Society Medicine, RSM 2020. And you can also visit Dr. Mustafa Zakaria's website, that is www.dr-mustafazakaria.org. So I welcome Dr. Ritu Santwani and Dr. Mustafa Zakaria on our platform for today's session. Thank you, ma'am.
Yeah. Thank you, Doctor. Yeah. Thank you, Dr. Nishan. Thank you so much. And thank you, Shield Connect, for providing us the platform. Dear friends, all of you are welcome for this academic exchange program. I always believe that knowledge always increases by the sharing, and knowledge is not limited to any boundaries. With this motto, I have started this series, The Icons in Conversation with Dr. Ritu. So today I am very happy to invite my dear friend, Dr. Mustafa Zakaria here. With Dr. Zakaria, I have done earlier also 3-4 programs in his society also. All are very well appreciated. And today he is going to discuss with us a very, very important topic regarding this elective oocyte cryopreservation for age-related fertility decline. Because in these days, so many girls are approaching in our OPD also, having a query. They have read somewhere the half information for the oocyte preservation. All are oriented to career. So now what are the new things in this? So Dr. Mustafa Zakaria is going to discuss with us now. Before that, tomorrow we are having one great symposium under the leadership of Dr. Mustafa Zakaria on the ovarian endometrioma. So all of you are welcome for that also. So now over to Dr. Mustafa. After his lecture, we can take some question answers. A warm welcome, salam alaikum to all of my dear friends who have joined all across the geography. Yeah, over to you, Dr. Mustafa. Yeah.
Thank you so much, Dr. Rauda, for this introduction. Thank you again with Dr. From India. Also, today this topic is very interesting with an elevation of oocyte cryopreservation. This is your interest topic. You pass for women who pass for infertility and evaluate and to comment this sexual of education have to correct to plan in education for is to fast also with an all information update about in oocyte cryopreservation in age-rich spite. Okay. Okay. Some conflicts not at all. Slowly. Fertility preservation incorrect. This you have two sections for that section. In the planned oocyte cryopreservation in cancer patient. This is very important is quarantine. This was ever immortal affirmations, and she is ready with off this in 2029. We cough is Espanol. Some women in have to this very important this table. You cannot have to we have result this for oocyte in cryopreservation. Same method of age to releasing. Some ways 23 years. This is crime. We always the emissions. How it doesn't make faith and so we talking men, strafing, I in some would have fried we loses in 10% of oocyte. So oocyte in cryopreservation, this in picture is very interesting with the plane of to in one side infertility to ovarian for infiltrations, to host for POC for endometriosis, for in syndrome for Kelly's in this picture is very strong for card. For an innocent of COSCP in Belgium. The plane oocyte in cryopreservation is in for section in who does women to work as POC. 90% for license offerings of the Peter Prize. With a first of Ishri in 2021, this award first is Hungary. How it doesn't work is in positive of reproductive intervention in lots of age. This is very interesting to make. How to use with woman who selects with growing up at first and to help with hearts in reproductive medicine and avoidance to more fast second. Elective of POS. It's another project. In 2015, houses of force to check into biologists have to check improve. This is quickly of life and to follow us. How do we subject and use the scarf to play of or size in cryopreservation? So in this table, you can to explain with the people of to name them for 100 the extent of oocytes in cryopreservation for yes. And what should be for cases of cancer? And what the difference between this daring of POS? So impossible. How to use in certain line of and the research of size of Kim and Renesen. So we have question, how would you correct of ultrasound for remains to open again for oocyte? This is one on oocyte fresh to spray and due for POS to gain for 98%. For oocytes in cryopreservation, it's all by the way of Europe with all the means in donor. But in West Europe, you can send 94% of oocyte fresh. We count in rectification, and so in inside for IVF laboratory. It's very interesting because children to have in treatment, so we count oocyte. It's effective of cryopreservation. PCOS, we do not release spice to habit of male and suicide. A sample protection for human on site. So the basis of AMH to on site to which increase between others, a number of oocyte in successful in reproduction in review and wasn't the dead. So increases private of estrogen in this control have to life in which have the system of data. Improvements for relax in limited of protocol, the strategy, how to go swapping in oocyte. To fast of the left overview in oocyte in cryopreservation to have noticed into precast for AMH. How to conclude this part in strategic of protocol, this you in successful in reproduction. To have we age spread. Ovarian stimulation.
Please mute other participants. Chitra, please mute other participants. Yeah, Dr. Mustafa. Sorry for inconvenience.
Sorry for interruption.
Ovarian stimulation does not increase to embryo impact. This table we cannot. How doesn't perfect in your sit. So increase for ovarian stimulation, this is control about present symptom and successful in chromosome is a normal embryo 34% of increase this on ultrasound process. How to visit in 900 for FSH, 27% for HMG to N plus. Start of ovarian amplification to block of it motor in limited to between embryo developments to fresh in verification of oocyte. This table was to explain for DNA for infractuation, how to use for oocyte in embryo, and the difference between us has paper with employees for pregnancy, fresh on oocyte. Subscribe in verification of oocyte in this form this time. In more oocyte to liver. 2020. This is good prime of oocytes to liver. How to increase so instant the slide for fresh oocyte in to carve on transfer for embryo. How to measure of number of age between 92 and 37. How to be scarping we have more oocytes in cryopreservation. Severe, so OHSS does not risk collecting the freezing all in protocol. The summary price we have is this result in 2021. We have you update for protocol as we does not previous in collection of the part. This part we enhance to spread it. I do this we in the selection of severe for freezing or surprise. Okay, in part this indicator we communicate of the mass inside slight effect. 39% of the binds on OHs hyperperplexed for incomplete. This for in AMH 16.13 million, BMI 2.2 preclisis, prepping and with in oocytes to greet pattern. How to basis on antagonist as is perfect. So into ovarian in simulation with private of to high interventions. Last way of antagonist enemies for in severe price. Tour of an apartment's POC. 2019 was 12.1% for Edis private. In 2020, this 7.3% for fresh ovary. Oocyte cryopreservation is 5 in 26M, 19.5 in 2020. Before brands include, but the fresh is increased. Those with nice is good in oocyte diversification with 7.3. This is 2020 is very good to use for verification of oocyte. And this table is also yes for about PCO. POC in prime with 17% to heart we oven is successful of pregnancy. We ask to live to person. However, to in 6.6% for two oocytes and fresh to have between ply with or transvaginous. How to finance tissues of kinds in combination affect pregnancy. to verify between IUI and IVF to bind in 12 to 7% with inhibitions by scant wood is to job of center. This all table when after use in laboratory in Spanish will goes to be in the best. Once the fertility and preservation, results of protocol with nights to pass in disease, to low in success in covered. POC, what the dice earned fresh or size in cryopreservation. Ovarian in testiculate cryopreservation. Toward finds with LH donor of chromosomes paired with the best. How is good is fertility for preservation? How is this covered? It's low. It's LH in rate of increases pi, which indirectly FSH is important. Some ovarian stimulation, the bag of bronze which those antagonists. How does profit in 2003? How to was high which perhaps woven in ovarian glass. This is puff is the fresh or size of cryopreservation. And this table was all in clinical outcomes on fertility preservation. So with the life in process rate between immodification, observation, and life to birth rate, this is something was good for banks. This is some of cycle office to Jefferson in 7.3%. Another wolf and successful of IVF, you need for something for 5. Then one is good for oocytes in fresh. Some is good for IUI in racing perfectant for a big stent in IVF, which is correction for in woman of cast with all cases dependent. 2020. So for endometriosis, for FPP on 1449, price discount. This of clinical outcome for fertility and preservation. Hormones for in-system pride. AMH are normally treatment for unpredicted increased pounds. When AMH liver start for the D lines, the request for information. How to use to ovarian stimulation or after rate, in high rest, in chromosome, in abnormal, in modified. Some would say in problem with abnormal with prepaid. PTGA has to be recommended. How to use the curve of oocyte and cryopreservation to press into pipe. Be in Simpson with the fourth in update in 2022. In this section of cancer patients. Age of fertility and preservation. This will on to play for age. Small, 28, in line 54. How it doesn't for FSH and MH? MH info AFS, ovarian insemination for protocol. Some with female to age remissions in the first time on months of ovarian. How was the testing of assisting in reproductive? How to for ART? How would do something for is good result of to immunization and combination about antagonist in ovarian stimulation, in transfer ovarian. Something is good, a prime of age. Age is very interesting with scope on women. It is art in fertility and preservation. Other which is good of ovarian insemination. Take home this message. Who is not insist in publish as a spiritual advice. Is to increase the sky to have two biologists of gender, improve crime. It was in one of number. This all size in cryopreservation, this total life praise trade. Other, how to measure improve because of has force. Elevated in outside cryopreservation is very important. How to reach goals in mice disease if IVF laboratory just inside center, inside clinic in hospital, such part in mass earlier the fresh outside and choose mice with biologists and choose mice in gynicos have it once. This is very increasing. And thank you for your attention.
Thank you, Dr. Mustafa, for excellent presentation.
Thank you so much.
Yes. So I have received some questions. Can we take that questions with your permission?
Yeah.
Yeah. So this is the first question is from Dr. Maria. Dr. Maria has joined all the way from the Spain. Her question is, can fertility preservation interfere with successful cancer therapy or increases the risk of recurring cancer?
Okay.
Yeah.
This question, they are not a victim of that is correct. Okay. So the infertility preservation must correct indirectly to connect with unsuccessful of the cancer. Cancer with treatment was, however, correct the successful of treatment if you wisdom with surgery in chromosome with a pipe on fertility and preservation.
Very true, very true. Thank you, doctor. The other question is from Dr. Ionis from UK. His question, what can parents do to preserve the fertility of a child who has cancer? A very practical question.
Yeah, this for child.
Yeah.
Fertility should be discussed. Was with children, the children thriving of cancer as soon as what old is enough to understand. But you connect with of children to make a request before in predictions to be in connected to have we cancer of children.
Yeah. Thank you. Yeah. Friends, those who have joined late, I am getting so many inbox messages. The program has gone live already on my YouTube channel. The link I've already pasted in the chat box. You can see from there. So now I'm taking the questions. We have received some questions via YouTube also. So the other question is from Professor Carlos Simon from the Spain. He has joined. How will the eggs be used in the future?
It's a good question. Because when the woman of ready to use for freezing age at hardship or pregnancy, this was in cryopreservation age of the plain water insulation to us for ART to have resolve an oocyte freezing with selective of increase for Higgs.
Yeah.
This
Thank
is
you.
a short answer is good for this question.
Yeah. No. This is a crystal clear, short and crisp answers. Yeah. So other question we are having from the Dr. Kiris. He has joined from the UK. What are the chances of a successful pregnancy using frozen thawed oocytes?
Really, this question is good for clinical pregnancy related. We have been to stimulation between 4 to 12% to power of an oocyte in freezing to how we know with more data will be to need have to letter of an ID there a successful rate of in oocyte cryopreservation.
Yeah. Thank you. Another question related to this only from the Professor Karasti has joined all the way from Sweden. It's actually same question almost. It's actually already have answered. So I'm taking the another question from the Dr. Krina. What are the risks associated with the oocyte cryopreservation procedure?
Procedure.
Yeah.
Okay. This for age of fertility rates, the rates with consumption for ART and Proctron. So, to ovarian gestation of IVF, in which indicator some tracks in hyperstimulation and syndrome, which is controlled with the different for age related of protocol. So, the age freezing rate of ovarian to hyperstimulation and syndrome, because with the eyes of race, the fertility, entrenchment, always to life for infertility.
Yeah, thank you.
Thank you.
Yeah. Another question is from Dr. Michael from the Austria. His question that how long can the eggs can be stored?
How long? The ovarian stimulation diet in choice of FSH to give me with live stimulation. With long for FSH in Galabit. Sponsors will give to us intermittent FSH directly. Informant how to use goals and bright pregnancy style. So we do need for injection of FSH as number 9 of this with outside of cryopreservation. This insemination with the pipe of to hyper for insemination environment.
Thank you.
Thank you.
Yeah. Another question is from Professor Stephen from USA. I think this doctor has joined little late because you have already covered in your talk. His question is, how is controlled ovarian hyperstimulation is performed?
Yes, different between of FSH and LH, how to ovarian stimulation was often with the tube and SILE number of indicator in ovarian. But injection of FSH to bind of number of USA to follicle with Professor Stephen Marcos, how would it doesn't for FSH to use for intellects, how to be in oocyte in cryopreservation with a dose of counts and correct of to generalize FSH injection.
Yeah. Thank you. Thank you so much, Dr.
Thank you so
Mustafa.
much.
Yeah.
Thank you.
Yeah. Dr. Nishant, any other questions you have received here in the chat box? Whatever I received in the YouTube and my inbox, I have taken.
So, ma'am, we cannot see any questions in this chat box. Participants, do you have any questions? So you can please put your questions here. Till then, ma'am, you can have that private, personal question round. Till then. Doctor.
No, today we are not having that.
Okay.
So, yeah. So, Dr. Mustafa, because tomorrow we are having a big symposium on ovarian endometrioma. So, Dr. Mustafa is the organizing
Thank you so
chairperson of
much.
that.
Tomorrow, tomorrow
Great.
we're ready for this workshop of Association of Masarim. This in really 80 for morning. For this workshop is very interesting for endometriosis of gyneco in reproductive medicine. Tomorrow is have a good day of gyneco. So thank you so much for the investigation about this webinar, and thank you, Dr. Another, what's his name is Russia of India. Thank you so much for introduction with me for this webinar. And thank you, Dr. Arauda, for investigation this webinar. Also, thank you so much. Don't forget to send me all for attendees. After 2 days, we send.
Yes. We will. I will send you.
Sure, sir.
We will send you. We will send you. So thank you once again, Dr. Mustafa, for taking out the time from your busy schedule. I know you are very busy for the tomorrow's workshop. So thank you once again for enlightening all of us. See you tomorrow at the workshop. Soon I am sending you the list. Yeah.
Okay. Thank you so much.
Yeah. So thank you, friends. A special thanks to my dear friend, Dr. Nishant and Chitra from the Shield Healthcare for providing us platform and arranging everything very smoothly. So friends, see you all on next Thursday at 8:30 p.m. With another very interesting session. We are having Dr. Rangina from the Nepal on the next week. We are going to discuss from basics to advanced of hysteroscopy. Now I have changed the session time from 8:30 to 9:30 p.m. Indian Standard Time, because as now all of us are working, OPDs are going on, so 8 p.m. is not possible for anyone to join. Even though 8:30 के लिए भी बहुत भाग कर आना पड़ता है कि 8 बजे तक घर पहुंच जाए. So that's why. But let's this academic discussions, interactions will keep on growing, because these webinars have a very good platform, so we can interact with all across the globe. So friends, if you are having any kind of the queries related to the session, you can post on the YouTube. The program has already gone live on the YouTube. And what other more topics you want that we should take in our upcoming sessions, please feel free to write to me or Nishant. We will try to discuss and take that topics. So thank you once again, friends, all of you who have joined. Bye-bye. Take care. Good night. Good night, Nishant.
Goodbye.
Yeah.
Goodbye.
Goodbye.
Bye. Thank you, Chitra, once again.